My name is Dr. P.D. Joshi. I am the Chief Coordinator for the Dental Department of Lilavati Hospital. I also work over here as a consultant endodontist, which means I'm a root canal specialist. So what is a root canal problem? Now, when you get cavity in your mouth, you get a small hole in your tooth, and the bacteria and the food will go and lodge into that hole, and it will start eating away your tooth substance, and gradually the hole becomes bigger and bigger, and eventually it reaches the deeper, softer portion of the tooth, which we call it as pulp, but commonly referred to as the nerve of the tooth. Now, when it reaches there, it causes infection of that area of the nerve of the pulp, and this will start giving you pain. The severity of the pain could be so much sometimes that you may have to reach a dentist in emergency, and the dentist would open that cavity and remove that pulp and the nerve supply from inside the root of the tooth. This is called as root canal treatment. Now, this is not the end of the treatment. Here we remove the nerve and blood supply and the pulp from the root. So in short, we make the tooth in a way dead, so that it never pains again in future. But we also seal that hollow space which was occupied by the nerve supply and blood supply. So what we do is we place some medications inside, we shape it well so that it can receive a nice seal, and this seal is foolproof so that bacteria cannot penetrate again and cause root canal infection again. However, sometimes due to some oversight, either the bacteria left behind by a dentist, the bacteria can come back into the root canal and cause infection all over again. So our job as a root canal specialist would be also to redo or repeat these root canals and make the tooth become functional and healthy all over again. So there may be some complications arise during that first root canal. So our job is to identify those problems, work towards it, solve those complications, and then remove all the previous infection, and then treat the tooth and make the tooth healthy all over again. And besides that, and this requires some special equipment, like we work with microscope, with which we can see in fact inside a root canal and identify the complication or the problem, and we know exactly where the bacteria hiding in the root canal. We can actually identify with the help of microscope and treat it. So this way we can work better because we have all the armamentarium and latest equipment to work with in the department to help the patient, and this way we can even safeguard and preserve the teeth which probably would have been lost otherwise. So do take or seek some consultation. Thank you.